Welcome to this educational program. This module provides an overview of rhinosinusitis, the inflammation of the sinuses. There are other modules available that describe the types, symptoms, and treatment of rhinosinusitis in greater detail. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. Some slides in this presentation show detailed illustrations, and you may wish to pause the presentation at times to take them all in. Requiring a continuous supply of oxygen, humans breathe between 12 to 20 times a minute, inhaling 500 to 700 milliliters of air at a time. Air enters the respiratory tract through the nose and the mouth, is heated, filtered, and humidified by the nose and the sinuses, and travels through the pharynx, larynx, and trachea to the lungs, where it exchanges oxygen for carbon dioxide. Lining the respiratory tract is a membrane that secretes mucus, a thick, slippery fluid that warms, moistens, and filters the air. Mucus protects the respiratory tract by trapping bacteria, dust, pollen, and pollutants we would otherwise inhale. It lines the sinuses in two layers, an inner liquidy layer, which moves easily, and an outer gel layer, which catches any debris. Tiny hairs called cilia, which beat up to 1,000 times a minute, sweep the mucus in a specific pattern toward the throat, where it is swallowed and disposed of in the stomach. This movement of mucus along the respiratory tract, often against gravity, is called mucociliary clearance. As mucociliary clearance keeps airways clear and helps prevent infection, it must be kept as uninterrupted as possible. Near the head of the respiratory tract is the nasal cavity, a large, hollow passageway behind the nose above the roof of the mouth. It is divided into right and left sides by the nasal septum and contains 3 bony plates, called turbinates, and 3 canals, or meatai. The turbinates are covered with a lining rich in blood vessels, glands, and cilia, and like veins in an air conditioner, increase air contact with the mucus, or the filter. The meatai provide space for airflow and mucus collection and can swell or shrink to affect air and mucus flow. The paranasal sinuses, or sinuses for short, are the 4 pairs of mucus-lined hollow spaces inside the bones of the face and skull. They are located on either side of the nose, the maxillary sinuses, in between the eyes, the ethmoid sinuses, behind the eyes, the sphenoid sinuses, and in the forehead, the frontal sinuses. Though their exact function is unknown, it is thought that the sinuses help to warm, humidify, and filter inhaled air, regulate pressure within the nose, contribute to immune defense, lighten the weight of the skull, give resonance to the voice, absorb shock from blows to the face, and contribute to facial growth. By producing half a liter to a liter of mucus each day, which empties into the nasal cavity, the sinuses contribute greatly to air filtration. Cilia propel the mucus into the meatai of the nasal cavity through tiny openings called ostia. Regular clearance of mucus into the nasal cavity keeps the sinuses hollow and sterile. This clearance depends on healthy cilia, thin fluid mucus, and unobstructed ostia. A change in any of these factors, therefore, could hinder normal mucus clearance and lead to sinus inflammation and infection. Fluidity of the inner mucus layer, for example, is essential for normal clearance. If the mucus thickens, due to such factors as dryness or cystic fibrosis disease, its transport through the ostia slows considerably, and this can result in thick mucus buildup left in the sinuses. The inflammation or swelling of one or more sinuses is called rhinosinusitis. Originally referred to as simply sinusitis, the term now includes the word rhino, meaning nose, as we have since learned that the sinuses and nose are most often inflamed together due to one continuous mucus lining. Approximately 37 million Americans and 4 million Canadians are afflicted with rhinosinusitis each year. It is one of the most common problems of the respiratory system and can affect people of any age. Forms of rhinosinusitis range from mild to severe and can be significantly uncomfortable, causing tenderness in the face, aching behind the eyes, pain, fever, and difficulty breathing through the nose. Rhinosinusitis can be caused by anything that impedes airflow into the sinuses and/or mucus clearance out of the sinuses. This can be brought on by infection, allergy, irritants including tobacco smoke, anatomical obstruction, foreign bodies, disease, dryness, and certain medications. Insufficient air circulation and buildup of mucus in the sinuses can cause pressure and pain and create formidable conditions for bacteria and fungi, or mold, to grow. As these microorganisms flourish inside the sinuses, the body's immune system responds by creating even more mucus. The swelling, infection, and increased mucus secretion in the sinuses all obstruct the sinus openings, or ostia, which further worsens mucus buildup, reduces air circulation, and causes infection. This cycle of mucus buildup, decreased airflow, pain and swelling, infection, and further mucus buildup continues, and this can lead to long-term or chronic rhinosinusitis if left untreated. Rhinosinusitis may be acute, meaning sudden and short, chronic or long-term, or recurrent, meaning repeated. Acute rhinosinusitis is the temporary inflammation of the sinuses from seasonal or animal dander allergies, or from infection due to pathogens such as bacteria or viruses. It typically has a rapid onset, lasts 4 weeks or less, and its symptoms completely resolve. Most cases of acute rhinosinusitis are due to viral infection. Chronic rhinosinusitis, on the other hand, is the prolonged inflammation and impairment of the sinuses. It is often brought on by allergy, anatomical obstruction, and conditions such as asthma, cystic fibrosis, or immunodeficiency, the decreased ability of the body to fight infection and disease. Its symptoms persist longer than 12 weeks and can be difficult to treat. The division of rhinosinusitis into acute and chronic types is a bit of an artificial classification created by physicians. Untreated acute rhinosinusitis may actually become chronic rhinosinusitis. They are often a continuous disease. Recurrent rhinosinusitis occurs as several separate incidences in 1 year, often triggered by seasonal allergy and allergy to animal hair, dust, mites, and mold. Symptoms associated with rhinosinusitis include facial pain, pressure, and fullness, nasal congestion, nasal discharge, a diminished or lost sense of smell, fever, headache, halitosis or bad breath, fatigue, tooth pain, cough, and ear pain, pressure, and fullness. To diagnose rhinosinusitis, your doctor will inquire about your symptoms, examine your nose and throat, and check for fever, tenderness, swelling, and obstruction. You may be referred to an ear, nose, and throat specialist, who can take a closer look inside the sinuses with an instrument called an endoscope. An endoscope is a long, usually rigid tube with a light and camera on it, inserted into the nostril to examine the inside of the sinuses. The images produced are displayed on a viewing screen. A laboratory test may also be performed, such as a biopsy or sampling of tissue, a blood test to rule out other medical conditions, or a culture sample to detect bacteria or fungus growth. Sometimes more detailed imaging of the sinuses and respiratory system is required, such as an X-ray or CT scan. Treatments for rhinosinusitis aim to lessen symptoms, reduce sinus inflammation, treat infection, promote mucus clearance, maintain open sinuses, and prevent complications. Treatments include non-prescription remedies, medications, and surgery. First, sinus pressure and pain may be soothed by breathing in steam, using a humidifier, getting plenty of rest, drinking plenty of fluids, applying moist heat over the sinuses, or flushing out the nose with solution called nasal irrigation. Symptoms can also be relieved with such medications as saline sprays, decongestant sprays, corticosteroid sprays, oral decongestants, oral steroids, antihistamines, antibiotics, mucus thinning medications called mucolytics, antifungals, and pain relievers. Immunotherapy or allergy shots may also help, and if rhinosinusitis symptoms do not improve after medical treatment, surgery may be required. An ear, nose, and throat specialist performs nasal surgery, which can clean and drain the sinuses, widen the sinus openings, remove fungal infections, remove anatomical obstruction such as nasal polyps and tumors, and repair a deviated septum, a crooked wall between the nostrils. Although you cannot prevent all sinus disorders, there are a number of things you can do to help prevent rhinosinusitis. Some doctors recommend quitting smoking, avoiding smoky environments, drinking plenty of liquids, decreasing alcohol intake, reducing outdoor exposure to airborne allergens or pollutants, getting a flu vaccination, taking decongestants during a cold, using air conditioners, humidifiers, and air filters inside home and work, and being treated for allergy if applicable. To summarize, rhinosinusitis is the inflammation of the sinuses, the 4 pairs of air cavities in the bones of the face and skull. The sinuses produce mucus, which is swept by cilia into the nasal cavity through holes called ostia. The sinuses can become inflamed and infected when the functioning of the cilia, mucus, or ostia is compromised. Rhinosinusitis can be brought on by many factors and may result in significant discomfort, but is somewhat preventable and is treated by remedy, medication, and surgery. Other modules in this series include what are the sinuses, the causes and effects of rhinosinusitis, and the management and treatment of rhinosinusitis. Here are just a few of many resources available to educate you on rhinosinusitis. These resources may also assist you. We sincerely hope that this module has furthered your understanding of rhinosinusitis. We wish you the best for the future, and thank you once again for viewing this educational program. Available that describe the types, symptoms, and treatment of rhinosinusitis in greater detail. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. Some slides in this presentation show detailed illustrations, and you may. Mucus protects the respiratory tract by trapping bacteria, dust, pollen, and pollutants we would otherwise inhale. It lines the sinuses in 2 layers, an inner liquidy layer, which moves easily, and an outer gel layer, which catches any debris. Tiny hairs Welcome to this educational program. This module provides an overview of rhinosinusitis, the inflammation of the sinuses. There are other modules filtered and humidified by the nose and the sinuses, and travels through the pharynx, larynx, and trachea to the lungs, where it exchanges oxygen for carbon dioxide. Lining the respiratory tract is a membrane that secretes mucus, a thick, slippery fluid that warms, moistens, and filters the air. Wish to pause the presentation at times to take them all in. Requiring a continuous supply of oxygen, humans breathe between 12 to 20 times a minute, inhaling 500 to 700 milliliters of air at a time. Air enters the respiratory tract through the nose and the mouth, is heated,